A herniation is a tearing of annular fibers which allows the nucleus pulposus to migrate. The most common age group of a cervical disc herniation is people under the age of 50. A herniation can be broad-based, which is when a herniation covers more than 25% of the disc space, while a focal herniation covers less than 25% of the disc space. A protrusion is when the base of the herniation is wider than the distance it extends out. An excursion is when a herniation is further out than the width of the base. A contained herniation is still contained within the annular fibers, while an uncontained herniation is not contained by annular fibers. A free fragment is when there is no remaining continuity of the disc material between it and the disc origin, aka a sequestration fragment. A herniation may result from annular fiber tears from a motor vehicle accident, microtrauma from repetitive flexion, and an insidious onset which can result from poor posture. The anatomy of a disc herniation involves the disc, which has the nucleus pulposus and annular fibers. It also affects the ALL, which is on the anterior aspects of the vertebral bodies, and the PLL, which is on the posterior aspect of the vertebral bodies. Muscles that a disc herniation can affect are the deltoid, bicep, triceps, and the finger flexors. And it can also affect nerve roots, usually C5, 6, 7, and 8 in the IVF. Signs and symptoms of a disc herniation is arm pain, which may result to disc material pinching a cervical nerve root, which can cause pain to radiate along the nerve pathway down the arm. Numbness, tingling can be present down the arm into the fingertips as well. The most common level affected are C5 and 6 and C6 and 7. Bilateral pain can be a sign of a central disc herniation. A C4 disc herniation, or C4-5 disc herniation can cause deltoid muscle weakness. C5-6 disc herniation can cause weakness of the bicep. A C6-7 disc herniation can cause weakness of the triceps. And a C7-T1 disc herniation can cause weakness of finger flexors. The primary orthopedic test is Jackson's compression test. This is where you would have the patient in a neutral position and compress, then laterally flex and compress, then laterally flex the other way and compress. A positive sign will be a recreation of the pain and having radiating pain down the arm. Ipsilaterally, this will cause compression of the IVF and compression on the nerve root, while the contralateral side will cause stretching of muscles and ligaments and cause IVF to enlarge. Other orthopedic tests that you can do are cervical distraction, which can relieve pain, shoulder depression, which will look at nerve root lesions, and Lhermitte's sign, which looks for meningeal irritation. Imaging for cervical herniation would be X-rays, MRIs, and CTs. Some treatment for cervical disc herniation would be to adjust or cervical distractions, and acute herniation would be to treat with ice rest, anti-inflammatory and supplements. A subacute herniation would be treated with heat and rest. You could also use ultrasound to decrease pain and inflammation. To rehab a cervical disc herniation, you would use muscle strengthening, postural exercises, and give advice on ADLs and nutrition.